Good afternoon and good morning, depending on where you are. Thank you so much for joining today's webinar. We're really excited that you're here, and we're excited to talk to you about the new HHS requirement for the use of a HIPAA-compliant telehealth solution by May 11th. And today I have the honor to present to you Chris Emper, who's our Government Affairs Advisor here with NextGen Healthcare, as well as Kelsey Belt, who is our NextGen Enterprise Senior Sales Specialist. So with that, I'm going to turn it to the agenda slide here. What we're going to do is have you walk you through the new regulations that are out from Chris Emper, and then from there, Chris will turn it over to Kelsey Belt for a brief demonstration of NextGen Healthcare's telehealth solution. So with that, Chris, I will turn it to you. Thank you.
Excellent. Thank you, Nicole. Thanks, everyone, for joining us today. I'm going to take just about 5 minutes here to walk you through, as Nicole mentioned, what these changes are. And really, she mentioned there are new regulations, but this is a situation where what's new is old. Because really what we're talking about here is the relaxing or the retiring of policies that have been in effect for about 3 years since the start of the COVID pandemic. So for many of us, we've been living in this world with relaxed healthcare regulations and sort of amended policies for 3 years, since January or March of 2020, and this year is the time when many of these policies, including these HIPAA waivers, are going away. So at issue here, the news that brought this about, on January 30th, the White House made this announcement through this statement of administration policy that you see a screenshot of on the left here, that they're going to be ending the HHS Public Health Emergency Declaration for COVID-19 on May 11th. So this emergency declaration initially went into effect in January of 2020, which seems quite a while ago, even before everything happened in March of 2020. But the way the law works is 90 days at a time, HHS has to reauthorize the emergency declaration. And they've done that 12 times since then, the latest time being on January 11th, which will expire 90 days from then on April 11th. But because of many different things politically happening, as well as the actual pandemic being in a different phase, on May 11th, they decided to end the COVID-19 health emergency, and they made this declaration on January 30th. So why this is important, there are several different policies that are tied up in the emergency. Medicaid continuous enrollment coverage was one of them, expanded facility and capacity waivers for hospitals and other healthcare facilities, vaccine coverage and testing policies, but most importantly for us, and the reason for the webinar today, enhanced telehealth policies and regulatory waivers. And as my next slide here shows, the key waivers that have been in effect since the start of the emergency are a major expansion of the Medicare telehealth policy program. And what's important to note here, with the expiration of the emergency on May 11th, through a law that Congress passed, the US Congress passed in December of 2022, just a few months ago, they actually decoupled the Medicare policies for telehealth that have been in place since the beginning of the emergency, all the things that have opened up that program, patients being in any geographic area, in any physical location, including their homes, expanding the list of eligible providers under the program to include community health centers, rural health centers, as well as several other providers, allowing for, in limited circumstances, audio-only services to be continued on. All of those things that expanded the program are actually going to continue on past May 11th through at least December 31st, 2024, although Congress is now considering legislation to make those even more permanent. But on the other hand, a couple of the regulatory waivers are ending on May 11th. Some policies for Medicare around patient copays and payment parity, but also most importantly, I think, the HIPAA enforcement discretion that has been in place since the beginning of the emergency. So really what the takeaway here is Medicare enhanced policies for telehealth that people have been questioning since the start of the pandemic, whether or not they will remain, they are going to remain in place, but come May 11th is the end of HIPAA enforcement discretion. What exactly does HIPAA enforcement discretion mean? My next slide shows in a little bit more detail, specifically from the Federal Register in April of 2020, what this notification means. So HHS and their Office of Civil Rights, OCR, that enforces the HIPAA privacy and security and other regulations, they put out this notification tied to the emergency that said healthcare providers, although before the emergency for telehealth services, you were required to use a HIPAA-compliant telehealth application, an application that certifies that it is HIPAA compliant, that would require you as a provider to sign a BAA with them to have those protections in place. During the emergency, as you see here, they waived that to open it up to say you could use Apple FaceTime, use your iPhone, you could use Google Hangouts, Zoom, Skype, other non-HIPAA compliant applications. That's been in place since March of 2020. Following May 11th, this policy of enforcement discretion, which basically means they're not enforcing HIPAA, and these fines and the potential penalties that go with this telehealth services waiver, that's all coming to an end on May 11th. So the simple takeaway is that the Medicare expanded telehealth services program is going to remain after May 11th, but you are no longer allowed to use a non-HIPAA compliant telehealth technology platform. And then before I turn it over to our demo today, my one last slide here is just going to reinforce that 3 years after the pandemic, the place and time we're at right now, there is a lot of heightened focus around HIPAA, privacy, and cybersecurity protections. So just last week, you see on the left here, the screenshot and the press release from HHS, they announced a reorganization and new divisions within their OCR, their Office of Civil Rights, specifically because they've said there's been a 70% increase in the last 5 years of violations reported to us, and we need to expand our ability to enforce these protections. So they announced a big reorg. They're ramping up as these waivers go away to begin resuming and enhancing resumption of enforcement of these protections. And then similarly, members of Congress, a bipartisan group of senators just last month was issuing a letter and looking into telehealth patient privacy issues, because really when you think about the pandemic, they relaxed all the waivers, they changed all the policies. In many ways, the industry changed. Telehealth is now a permanent part of the healthcare system in a way that, although it was around, was certainly not with us before the pandemic. Now, post-pandemic, HHS, members of Congress, they're all looking into this and saying, what does this mean on the regulatory front? And a big part of that is ensuring that privacy and security regulations are going to be enforced. So I'll just underscore that, as I say, with the transition here, do not ignore these rules, these protections. And I know it's easy to get lax on HIPAA security. It's never a fun or an interesting topic to talk about, but it's certainly an important one. So with that, those are the changes in mind. Remember, again, you need now a HIPAA-compliant telehealth solution if you already don't have one in place by May 11th. And with that, I'm going to hand it off to Kelsey to give you a run-through of a very HIPAA-compliant telehealth solution, NextGen's virtual visits platform.
Thanks, Chris. So again, my name is Kelsey Belt, Application Specialist, and I'll be taking you through a brief demonstration of the virtual visit platform. So ultimately, the power of a telehealth solution that integrates with NextGen Enterprise EHR and practice management is really going to ensure that smooth and seamless user experience for your providers and your patients while maintaining NextGen as that source of truth for patient data, utilizing that HIPAA compliant platform. In addition to being tailored to your practice's workflow, you can connect with your patients on any device. So I'm going to go ahead and share my screen here. So ultimately, the patient's journey begins with an automated, consistent, and timely email or text reminder of their upcoming visit, as you see on the left-hand side here. This is where the patient can easily check in for their visit with the option to invite a guest, test their device, and then with one login free, they can go ahead and initiate and log directly into the virtual visit. So again, that login free patient experience without the need to download an additional app on their computer or their phone. One simple click of the join visit will launch them into the virtual waiting room. Now, once that patient launches into the visit, this patient will automatically be checked in for their appointment in practice management, as well as communicate to the provider that that patient is ready to be seen. Now, from a provider perspective, what you're seeing here is a login to the provider to access the provider dashboard. So what this is going to show is it allows the provider to access the virtual visit schedule, where he or she can see any sort of intake questions that were perhaps filled out by the patient upon check-in. Again, this is configurable based on how you want to set your intake questions up. So here you have your upcoming appointments on the left-hand side. The provider can toggle to any completed appointments over here. But in this view, as you see here with Jennifer Kilborn, for the virtual visit, I do have the option to add a guest to this virtual visit as well. And then it's easy for the provider to then instantly join that visit. And how I know the patient is actually in the visit is this is illuminated in green. So the provider knows that that patient is waiting in the virtual waiting room for the provider to join. So the provider can simply just tap on join visit and it's going to launch into that virtual visit where the patient will be waiting. I'll mute myself here, switch my camera view. So now here I have Jennifer at the forefront at the patient focus. I'm seeing patient in front of me. On the patient's end, she'll see me in the center screen and the large square you see in the center of the screen here. And of course, me as the provider is here in the top right. Now, I'd like to call out a really nice feature in our virtual visit platform before I go over all the other tools that the provider would have available. So with the patient still in focus, the provider can actually place the patient in picture mode where they can now navigate to the patient's chart while they're still in the virtual visit. So now I have the patient still in focus. I'm able to access the patient's record, view the patient chart. Perhaps I need to view any sort of lab results, imaging reports, but really this is for streamlined clinical documentation while still in that patient in focus during that virtual visit. The provider can easily say back to tab and navigate back to the virtual visit. In addition, some tools that the provider has down here below, they do have the ability to share screen with the patient if they need to review any sort of imaging or documents, or as they're navigating the chart, they can certainly share their screen with the patient here. They do have the ability to call in an interpreter for any sort of interpretive services. They do have the ability to share documents, so patient education documents, they can share back and forth with the patient, as well as the ability to chat with the patient. So if the audio is off, they don't have the ability to actually have that audio communication, they can still have that chat communication all within this virtual visit. So a lot of different tools and variety of tools that the provider has during that virtual visit, during that visit with the patient, to be able to properly communicate, navigate the patient's chart, streamline their documentation, as well as share screen to go over any sort of lab results or imaging reports. Now, once the visit has ended, a virtual visit summary will be available in the patient's encounter, which can then be sent and streamlined directly to the patient's portal. So ultimately, NextGen Virtual Visit provides that robust, fully integrated HIPAA-compliant platform, which ultimately allows you to easily connect with your patients on any device, while providing that consistent experience whether they see you in the office or through a virtual visit. So really, this increases the convenience and peace of mind for your patients at your practice and expands the accessibility for patients who perhaps require that chronic care follow-up or an easier follow-up appointment for lab results, diagnostic imaging results. Just really provides that patient convenience to really meet the provider when it is convenient for them, allowing them again to join on any device for that virtual visit. And that concludes the demonstration for today.
Great. Thank you very much, Kelsey, for that wonderful demonstration. Let's go ahead and open it up for some question and answer to conclude today's presentation. I do see in the chat that there are a couple questions. If you have any questions, please feel free to type that in the questions section of the GoToWebinar control panel. The first question that I see out there, Kelsey, this one's for you. Is there a place to find the requirements for audio-only calls? They have some rural patients that cannot get enough connectivity to be on video, but they can call in.
So as far as indicating whether it's just an audio virtual visit only and not video?
Correct.
So that would be essentially on the invite that they would receive the email or to be able to test their device. I do believe that they do, and Wendy, you may need to add some color here for the virtual visit accessibility through just audio only, but they don't have to have the video turned on. They can access the virtual visit by audio only.
Yeah, that's correct. They can dial in and just not have the video portion turned on. And as Chris said in his presentation, it is also being reimbursed for audio only telehealth visits as well. Correct.
I'll just add for Medicare, and this is all payer specific. So Medicaid and commercial payers all have their own policies and rules. So
Right.
it gets very complex. But long term here, I think as the policy has shifted, it's clearly going to where you're going to have reimbursement and a higher reimbursement for a live video and audio visit as opposed to audio only, with some minor exceptions in those type cases where you don't have a patient who has the ability to access the video.
Right.
Okay, there was a question that came through around, is this different from Auto telehealth platform, or is this the same? NextGen did acquire Auto telehealth a couple of years ago. This is now NextGen virtual visits or NextGen telehealth platform. So there is enhanced functionality now post-acquisition. Are the appointments integrated with the PM? Wendy or Kels will let you handle that.
Yeah, absolutely. So when an appointment is scheduled in practice management, that appointment then flows over into that virtual visit dashboard that Kelsey shows you. As well, within that virtual visit dashboard, you can actually pull a patient through from the PM NextGen database that you have to be able to schedule from the telehealth dashboard as well as practice management dashboard. So absolutely. And if you're using patient self-scheduling, it'll go from self-scheduling to practice management to that virtual visit dashboard as well. All integrated fully, yes.
Perfect. There's a question that came through about the name of this application. It is NextGen Healthcare Virtual Visits or NextGen Healthcare Telehealth Platform. And if you're interested in learning more, you can contact your account manager or account executive. They can assist you with that. Another question that came through, if patients can check in themselves, how are the co-payments handled? Wendy or Kels, we'll direct that to you.
We do have the functionality to turn the copay on at the time that they check in. You can require co-payments, and that would flow into PM just like any other like portal payment through Instamed. We just don't have that turned on in our demonstration environment, but yes, we do support the ability to use a copay.
Thank you. A couple of you asked where you can find this recording, or if you showed up late for the recording, a couple minutes late. We will post this recording out to Success Community. If you registered for this event, so for those of you that are on, you are going to receive a copy of it as well. And we will equip the NextGen account management and account executive team with copies of the slide deck as well, so you can have access to that. Regarding the cost of this solution, that was another question that just came through. Please contact your NextGen account executive to learn more there. Okay, I believe this would go to you, Chris. The question here is, will other payers follow suit and adopt these Medicare extensions, or will they require that every provider get licensed?
Great question. So it's often the case that commercial payers follow what Medicare is doing, but not always the case. And I think in terms of COVID emergency policies, most of the commercial payers have already changed their policies back several years ago, noting that the pandemic had moved to a very different phase even in 2021 than now. Federal government has lagged behind a few years because they wanted to keep some of these emergency policies in place, and it was just easier for them to do so. But I will distinguish, as I did, I think, on my second slide, that all of the Medicare extensions are completely separate than the end of these HIPAA waivers. The HIPAA waivers apply not just to Medicare, but to Medicaid and commercial payers as well. So that's a policy that's agnostic across all payers, as opposed to the Medicare enhanced reimbursement policies. But I think the way things are going, when you see Medicare extending these things through, or Congress extending the Medicare waivers through 2024 with a little asterisk on it that says they want to extend them permanently, they're just not quite ready to do it now. I think everybody's kind of moving in that direction. Some commercial payers are further along and have better reimbursement, some less, similar with Medicaid. But I think it's all moving in that direction, that the pandemic was really a catalyst to move forward telehealth reimbursement into an entirely different area than it was before. And without the pandemic, it might have taken a decade or more to get there, but now it's happened in the period of just a few years.
Perfect. Thank you, Chris. Well, we'll just take one final call for any additional questions. If you can type those in the questions section of the control panel. While we're just waiting to see if there's any other questions that come through, we'll go ahead and put some final comments out there. Just wanted to thank you all so much for your time and investment today in this webinar. Thank you to Chris Emperor and Kelsey Belt for a wonderful presentation. And if you're interested in learning more, please contact your NextGen account executive. Thank you so much, everyone. Hope you have a wonderful day, and we'll post the recording and slides. Thank you all.